All right, let's get it. Contrary to popular belief, healthcare is wealth care. This will be the first in a 4 or 5 part series on capitalism. For those who don't know, capitalism is how our country is run economically. One of the core values is a free market with limited government oversight. Because this is such a broad topic, I decided to break it down into 4 subcategories: healthcare, manufacturing, education, and politics. I may also add a video for inflation. We'll see how it goes. Also, I'm going to have a special guest, my brother from another mother, KG, a guy that I've known since kindergarten. So without further delay, let's dive in. On a per capita basis, healthcare spending has increased exponentially since 1970. In fact, healthcare costs were about $1,832 annually per person. According to healthsystemtracker.org, the annual cost per person in 2018 was a staggering $11,172. There are many factors that contribute to this increase, like inflation and technology with all of the advances and upgrades that have been made to equipment. And some of it is just plain old greed. KG, you got anything you want to add?
Yes, sir. Um, so we want to talk about both sides of this argument as far as healthcare goes. So we have what you just mentioned, the greed of these corporations. But one of the biggest issues that we have with healthcare is there really is no system at all, no structure. We have a system where large companies have been able to buy up small hospitals at will. According to an article, I think it was back in 2016, thehill.com, from 2012 to 2017, about 1 in 5 of all the nation's hospitals were acquired or merged with another hospital. It's just crazy considering that our government has come along over the years and done everything that they can to break up big corporations and stop them from becoming monopolies. But now, with healthcare, it seems to be something where they just sit back and allow it to grow and grow and grow with no oversight.
Cool, cool, cool. I'm glad that you actually brought up hospitals. That leads right into the next segment. Now, to be clear, I don't want to spend this video reciting a bunch of statistics. You can Google or research on your own. The information is out there. With that being said, I will touch on a couple because I think they're pretty important. In 1973, the government enacted the Healthcare Maintenance Organization Act, or HMO Act, which basically gave hospitals the legal right to operate for profit. Most didn't act on it and remained as nonprofit organizations. In fact, as late as 2003, only 20% of the 39 hospitals across the US were for profit. So what's my gripe with for-profit hospitals? Well, I'm not naive. I know that it takes money to operate any business. I know it takes money to pay employees, for building maintenance, to pay for supplies, etc., etc. My gripe can be summed up in one word: upsell. Can you really trust your doctor when they refer you to a specialist? When they recommend the latest and greatest prescription drug, can you be sure that you really need it? That leads me right into the pharmaceutical industry. The total cost of prescription drugs is projected to continue climbing. U.S. spending on prescription drugs have grown rapidly over the past decade, climbing from $783 per capita in 2007 to $1,025 per capita in 2017. The Centers for Medical and Medicaid Services project that such spending will continue climbing to $1,635 per capita by 2017, an increase of 60%. Overall, the U.S. spent about $330 billion with a B on prescription drugs in 2017, a 40% increase from 2007. That total includes both public and private spending, meaning it includes both out-of-pocket costs by Americans as well as costs borne by insurance companies and government programs like Medicaid. And excuse me, I meant to say Medicare earlier and not Medical. KG, you got anything you want to add?
Yeah, I kind of want to come back around to the hospital talk. There was a study done by Carnegie Mellon where it shows that prices are 12% higher at monopoly hospitals. And what I mean with monopoly hospitals, when you use some of the big corporations that go and gobble up all the small hospitals, that's what I'm referring to. It means that if your primary care physician is associated with that big hospital, your bills will more than likely be higher than if you had a situation where you had local competitors, like 3 or 4 hospitals that you had a choice in your local city.
Good stuff. All right, moving on. So this slide on the screen pretty much sums up what KG and I were just saying, that the overall cost per capita is just going to increase as the years go by. If we don't get this under control, come 2027, healthcare will be totally unaffordable for the average American. So maybe I just have a warped sense of humor. I'm amused by all of the side effects that are listed on drug commercials. The potential side effects are far greater than the illness that they're supposed to treat. Let's take a look at Martin Shkreli. You guys know who that is, right? The guy who jacked up the price on the EpiPen just so he can increase his revenues. I'm not saying all behave in this manner, but it should make us all cautious. Listen, I want to conduct a little experiment after you finish watching this video. Go to your medicine cabinet and read the label or box. See how many contain the phrase "for temporary relief." Why? Because the goal isn't to cure your illness, it's to keep you coming back for more drugs. For the record, this isn't an indictment of healthcare workers. My wife is a healthcare worker, as well as others in my family. From my point of view, the decision makers are the ones to blame. They're the guys who make the decisions to put profit over public service. Since we're talking about health-related issues, let me touch on this really quickly. In my "You Are What You Eat" video, I highlighted how our diet plays a pivotal role in our overall health. In my Numbers Do Lie video, I highlighted how socioeconomic issues may contribute to our health as well. I'm about to try and connect those dots, if you will, and show how it's all related. I'm a person of color, and to be more specific, I'm a black man. If we were to journey back in time, it's safe to assume that slaves probably didn't have the best or healthiest diet. It's safe to assume that the masters got the best part of the animal and the slaves were left to eat the scraps. That's why we eat pig's feet, chitlins, hog maws, ham hocks, pig ears, and all that other filthy meat. By the way, any part of the pig is filthy, but that's another story. Fast forward to today, and some of us still eat that way because it's how we were raised. Also, because it's what we can afford. See, healthy food is very expensive. Why? I may answer that in a future video. So the poor diet is a factor. And add that to the fact that some of us can't afford health insurance. And now you can't get screened for certain diseases or afford preventative care. And all that leads to black people suffering from high blood pressure, heart disease, diabetes, and all those other illnesses they attribute to being black. The truth is, it has nothing to do with your genetic makeup, which to me seems to imply that you're somewhat inferior. No, that's not true. That's someone's agenda. Socioeconomic issues contribute greatly to our health care. Does any of this make sense? Basically, what I'm saying is some of us just can't afford to be healthy. Let that sink in. In America, some of us can't afford to be healthy. KG, what are your thoughts?
Kind of going into what you were just referring to. I can go to the grocery store and pick up pretty much anything I want that's unhealthy for me. Spend about $20, walk out with 5 or 6 bags of groceries. But if I want to buy anything that's healthy, if I spend $20, I may walk out with enough for a snack.
Cool. So let me finish with the bad word. Socialism. The GOP has done a great job framing socialism as something evil, sort of framing it as an antithesis to freedom or choice. But what is Medicare or Medicaid? Those are government-paid health programs which are a form of socialism. See, the misinformed are tricked into voting against their own interests. Some of you are so against the Affordable Care Act, even though the Affordable Care Act is designed to negate the rising cost of health care. Not because the government will demand price reductions. No. It's because hospital costs will stabilize because everyone will have coverage. Thus, hospitals will no longer pass on the cost of the uninsured or underinsured to those of us who can afford to pay. This is also a contributing factor to rising health care. Those unpaid invoices result in higher costs, which results in higher insurance premiums. This is why insurance companies kick so hard against the Affordable Care Act. It's not because they just want a free and fair market, even though that's what they tell you. If the market stabilizes, they will have no reason to raise premiums. Thus, profits will also stabilize and will no longer increase. See, to put it simply, healthcare is wealth care. KG, you want to jump in?
Yes, sir. The way this system is put together now is far from a free market. Therefore, capitalism seems like an afterthought. Now, why am I going against what this episode is about? Well, I'll tell you. We live in a country where capitalism is the law of the land. But somehow what happens in this industry is largely kept a secret. Think about it. Why is it that I don't know how much a 3-night stay in the hospital is going to cost me? It's pretty much a crapshoot. If it truly was a free and fair market, it would be easy to make a choice as to where I am admitted. Unless we get rid of the lobbyists and the political BS, which we'll talk about in a later episode, we simply will never have a clear and concise system in this country.
All right, thanks, Brother KG. I can go on, but I think we'll leave it there for now. So if you like the way I think, hop over to Patreon and check out some of my original short stories. It's only $1.50 per download. The link is in the description box below. Also, don't forget to like, share, and subscribe so you won't miss out on our future videos. I just want to take this time to say thank you to my brother joining in. Appreciate you. It's good stuff.
Yes, sir.
All right, well, we'll leave it there for now. So like always, thank you for your time. Peace.